If you missed it the other day, I did a special broadcast of the Clark Howard Show trying to demystify the rollout of Obamacare, the healthcare exchanges, who's covered, who's not. And as you might imagine, during the broadcast, I had a number of people who were kind of sore politically, and that wasn't what I was trying to do. I was just trying to answer questions about the practicality, about how you buy coverage. And it was interesting because over the couple of hours, people kind of morphed into where they were asking practical questions, regardless of how they feel about the president or Obamacare. And I felt grateful for that because that really was my intent. If you are a regular listener of mine, you know that I would do healthcare very differently in the United States. But ready or not, Obamacare is here. It's the law of the land. And so I wanted to answer questions. There were a lot of people who had very specific questions for me that I ran out of time. I could not address in the 2-hour special. So I wanted to tackle some of those right now. These are questions that were posted at clarkhoward.com, on our Twitter feed, on our Facebook page. And I have one here from Scott who says, if people are living paycheck to paycheck, can't afford health insurance now, how are they going to afford it after the ACA kicks in? That's the official name, Affordable Care Act. I mean, even with subsidies, they're still going to be paying something, right? Well, believe it or not necessarily. If somebody is very low income and they pick one of the cheaper plans, they may not have to pay. Their fellow taxpayers may pick up the premiums for them. And Scott, they may not have to pay any money through a policy purchased on the healthcare exchanges, or it may be a very small amount. But as far as not being able to afford healthcare already, a health insurance plan, if that's something you choose not to buy, that will still be your choice in 2014. Someone whose lower income would face an annual penalty of no more than $95. Someone whose higher income would face a minimum penalty of $95 for the year, or roughly $8 a month if they choose not to buy a policy. Here's a question from Mary. My husband and I are over 70 and are covered by Medicare and TRICARE for life. How will Obamacare impact us? Essentially, for people on Medicare and you with a benefit that is a military benefit, there will be nothing that will change of any significance for you at all. You continue your coverage just as you are. And I'd like to say, Mary, that there's been a lot of people who are on Medicare who have been solicited by scamsters. Anybody who calls you who says they need to talk to you about your Medicare or your TRICARE, and if you don't do this, that, or the other, well, it's going to stop. It's going to be taken away. Know that they're trying to scam you. And thank you for your service to our country and the military. I have a question here from Kevin. Kevin says to me, I'm a retired U.S. Postal Service employee, received my health insurance through the U.S. government. Will my coverage change with Obamacare? As far as I know, Kevin, I know of no changes that will affect you. That is something that maybe over time will change. But as we look into the immediate future in 2014 in particular, there's nothing that changes with what you get. That continues as it is. And in reality, anybody who has employer-provided health care, health coverage, there may be some things on the periphery that change, but for the most part, at least for now, things stay as they were, as they are. I have a question here from Donna, which, Donna, you couldn't have posed a more perfect question coming out of what I just said about, in most cases, most people, employer-provided, things don't change. Donna asks, what's the Cadillac tax? My husband's company says they're trying to avoid this. So what effect does this have on individuals? So, Donna, the story is there are certain key employees, usually executives or very, very highly paid individuals, who get ultra generous health plans as a way of getting non-taxed compensation. Because, your husband, if he's a high income earner, is getting taxed really high tax rates on his income. So what a lot of companies do is they channel money through the healthcare plan tax-free to benefit people at the very high end of a company. So there's a new penalty in the law that will affect him if he is, in fact, in what a lot of people have referred to as Cadillac plans. That affects a tiny, tiny number of people. So what am I up to here? Let me tell you something. Some of the questions, I may sound like I'm an apologist for Obamacare or whatever. No, what I'm trying to do here is help you cut through the clutter and the rhetoric and understand how changes are going to affect you. And you can stay up to date on Obamacare at clarkhoward.com. And I'm just trying to serve you as best I can. Where there's a lot of noise out there, I want to try to cut through that noise and stick strictly to facts. And if you've been watching, you've heard on some answers, there's a little bit of hedge on me. There's a little bit of, for most people, things like that. I cannot address every situation with certainty because we're talking about more than 1/6 of the U.S. economy. A law that has hundreds of pages, a lot of caveats to it, a lot of complexity. I'm trying as much as I can to explain it in the clearest, simplest terms I can, and I'm hoping with a high degree of accuracy. This is an ongoing process. I want to tell you that I am here to serve you, and I will continue to do so each and every day, each and every way that best serves your needs.